each of the countries. We have a distinguished panel here with us today, and I will introduce them as we go forward. The process we'll follow today is to have each of them do a presentation, and we'll then have one of our South African scholars, Professor Rasigan Maharajh, who raise the issues in terms of questions, and the response in terms of questions, and then we'll open up to the floor for discussion. I have one apology from Professor Olive Shisana, who was going to present aspects of inequality on health in South Africa, and in her absence, she has kindly requested Ms Meridith Evans, who will give her presentation on her behalf. So we accept the apology. Without further ado, I'd like to call on, we're going to follow the order of the BRICS acronym. I'm going to call on Dr. Edison from the Institute of Applied Economic Research, IPEA, in Brazil. Dr. Filho specializes his research on infrastructure finance. He's an economist, has a PhD in economics, and he will talk to us briefly about the inequality issues in Brazil. We each have 15 minutes. I'll let everybody speak before we have questions and respondents. Dr. Filho, please come forward. I will warn you about the time.
Thank you very much. My presentation here is kind of a bit out of space because some of you might be wondering what infrastructure projects, economic infrastructure, has to do with inequality. I show with my presentation that some issues involving measuring the costs and benefits of infrastructure projects are much of concern for addressing economic disparities, especially in my country. So. Okay, I'll tell you when to change the slides, no problem. Just basically some of the challenges for financing infrastructure projects in emerging economies. Most of you must be aware of some of these issues. Can you please go back a slide? Once the prior slide. Developing countries spend, according to the World Bank, almost $1 trillion infrastructure in the year of 2014. But the World Bank estimates they should spend at least, they should double that number in order to meet their growth goal, their growth targets, which means that they cannot sustain the economic growth rate they are experiencing with the degree of investing in infrastructure they are doing today. Now, obviously, these countries cannot rely solely on public government, on public investment to do so. Neither multilateral institutions have the capability to provide all the money they need for these projects. Still, we cannot, so far, most of developing countries could not access private investment, the private investment they needed to couple with this project demands to. Recent data shows that private infrastructure investments actually fell from 186 billion in 2012 to 150 billion in 2013. And it's less than 15% of the total spending, the total amount of spending in this projects. So we're still far from attracting private capital to these projects, and we're still depending too much on the public spending. And we are talking about countries which have a lot of social demands that need to be addressed along with the infrastructure projects. So we have a major political problem too. Obviously, banks and pension funds and other institutional investors could be accessed, especially on the richest countries, could be accessed to provide the money developing economies need to finance their infrastructure. However, we know that there are a lot of institutional issues, along with some economic issues too, that constrain dramatically constrain this option. For instance, in my country, we have just lost our investment grade about 4 days ago, and we're still trying to measure the impact that will cause on some of the major infrastructure projects we were trying to implement for the next years, and we were counting on foreign investors to do so, but now we have to do the accounting again if we will be able to reach that money. And here I also pinpoint some of the major features about the BRICS, or how they finance their infrastructure. Obviously, this is some kind of reductionist analysis, but just some stylized effects. While China emphasizes the role of domestic banks, Russia relies mostly on the strength of their major state-owned firms. India, on the other hand, is favoring more and more public-private partnerships. And Brazil also depends largely on its major public bank, which has been the BNDES, Bank of National Development and Bank of National Economic and Social Development. While South Africa seems to have a more balanced financial structure, where it can combine both public credit and private credit, and they can assess those two sources of resources for different structure with relatively success. Here's just some numbers on the size of the financial sectors among the BRICS. I took them from another paper. Just to show, obviously, China is the largest, has the largest financial market. But when you see all the sources of funds in these markets, either the stock market, the bond market, or the bank assets, each country, each one of the BRICS have a different pattern. It seems to privilege one of the sources instead of the others. Please. Now I'm going to talk a bit about the Brazilian current infrastructure dilemma. The bulk of Brazilian federal government investment goes to major infrastructure projects on transportation, energy sector, and all these major projects. And less and less over the last years, less and less resources have been provided by the federal government to other infrastructure projects, for instance, urban infrastructure projects, which are most demanded by the poorest people, poorest strata of the population. And local governments are currently facing a major fiscal crisis. Obviously, the federal government too, but the problem is even bigger among local governments. Local governments in Brazil, especially municipalities, are most dependent on transfers from the federal government in order to accomplish their requirements. And most of them lack completely the capacity of investing. They use all the money they collect from taxes, from municipality taxes, they use that money to pay salaries. So every spending on sanitation, building schools, building hospitals and this kind of thing, all this money comes basically from federal government and a minor share from the state government. And now, since we are facing a major fiscal constraint and federal government's money is falling short from what we need to accomplish all these goals, the dilemma is clear. Either we will continue to finance these major finance projects as we did until today, with billions of dollars in subsidies and public credit, subsidized public credit for these projects, or either we will put that money in other projects that benefit the poorest parts of the population and open space for private investing in this major infrastructure project. Because despite increasing their costs, the people who benefit from them can pay. That's what we are going to show. This is an example of a road concession in Brazil that we analyze in our institution. The second column shows which are the costs of investing in this specific concession. Those costs are calculated estimated for 100 kilometers of this road. So the second column shows which are the costs for society, which society incurs in order to do the spending to recover this road. And obviously the data which is in green is the benefit that you can get for doing that spending, especially for society on accident reductions that you can benefit. But also for the users of the road, you have a lot of benefits, including vehicle maintenance and time saving for these people. There are other benefits that are not considered here because it would be much more difficult to measure. But what we can see in this example is that the net result of the public investment in this road was largely unbalanced in favor of the users of the road. And despite society have benefited, the benefit for society was way short than the cost the government had to pay for this investment, as you can see in the net result, the last row in red. Please. And this graph shows the household monthly income per person of the people. All these lines show, each one of these lines show a different province, different state of Brazil. And the line in yellow shows the median, the average for the entire country. The line in blue shows the median income of road users. And the line in red shows the median income of the local population in general. Because most of people obviously either do not have a car, or when they do have a car, they do not travel so much, they do not depend on the road so much as the other users. So what we can see is that the median income of the people who use the road is far greater than the median income of the rest of the people. So when you subsidize a project to benefit that benefit these people, you're actually benefiting a privileged part of the population at the expense of the rest. And when I said at the expense, not only because the rest of the population are paying for that, but especially because of the cost of opportunity. You are spending a resource that could be spent in other areas, such as public health, education, sanitation, and a vast other areas that demand public investment too, but could benefit more and more the poorest part of the population. But despite recognizing this imbalance, the Zambian asset distribution of benefits and costs, the government insists in doing, in designing their concession, their concession process by means of using the lowest price for users criteria, which obviously will benefit the users. But what happens is that you create a problem of moral hazard too. The firms who gain these concessions, they depend largely on the public banks' finance in order to be able to provide that lowest price they promised during the process. So it's like the government is fooling itself. It believes that the firms will actually cover that price for the users, but actually it's the government who is going to pay for that price, because that price cannot be reached without subsidizing public credit. We proposed in our institution, I won't take so long, this is just a minor information, just a lot of information, but we proposed an alternative scheme, which would be, we were instead of adopting the lesser price for the users, we would use a fixed price for paying for using the road, but the company which would win the concession would have to rely on private credit. So the government would put less money in this project. Obviously, the price for the users would rise. But even if it was calculated in about a half of the benefit for the users, in other words, the user will still benefit a lot of this. If you, just with this minor change, the amount of public credit that you would demand to be put in that project would fall down dramatically. For that example, I forgot to put here in the numbers, but for this example of that road, we estimated the government would economize, would save almost 1 billion reais. There's something like more than $200 million just for one project by changing this criteria without punishing.
Maybe BRICS have found, but this is a little bit far off. Okay, this is it. Okay, yes.
Thank you very much. Our next speaker is Dr. Rumi Aijaz, who is from the Observer Research Foundation, and his specialty is urban governance, and he's going to give us a brief overview of the levels of inequality in India.
Thanks a lot, Chair, for giving me this opportunity. Good afternoon, everyone, and thank you very much for attending my presentation. I wish to share some of my observations on the state of inequality in India and to make an attempt to suggest some ways in which this problem can be overcome. The title of the presentation is Strengthening the International Cooperation for Reducing Inequalities, Perspectives from India. In my presentation, I will cover 3 topics. The first one is to provide you an overview of the country. The second one is the forms in which inequality exists in India and the ongoing initiatives that are being taken by the current government. And the third topic, which I will cover, is to explore how countries can work together to overcome the problem. As you know very well, India is an important country in this South Asian subcontinent. After a long period of struggle with the British administration, the country gained independence in 1947, and today it is bounded by a number of countries towards the northwestern, northern and northeastern parts, such as Pakistan, Afghanistan, Bhutan, Nepal, China, Myanmar and Bangladesh. And towards the south, it is bounded by the Indian Ocean, the Arabian Sea and the Bay of Bengal. India is a union of states. At the moment there are 29 states in the country, and these states are further divided into districts for administrative purposes. Insofar as the government and administration is concerned, India is a democratic republic with a parliamentary system of government, and this is the arms of the government are shown on this slide. The executive, the judiciary and the legislative wings are there. The real executive power lies with the Prime Minister and the Council of Ministers. The Prime Minister has very recently formulated a think tank called Niti Aayog to take major policy decisions with the involvement of the state governments. There are 29 states in the country, as I said, and 7 union territories. There are over 600 districts, over 600,000 rural areas, and about nearly 8,000 urban areas. In the 2014 general elections, the Bharatiya Janata Party, which is led by Narendra Modi, who is the Prime Minister of India, came to power. The previous Congress government was unseated due to problems of corruption and faltering economy. In terms of the population size, the share of population has been as much as 17.5% of the world's population lives in India. This is next to China, which houses 19.4% of the world's population. The total population of India as per the Census of India 2001 is 1.2 billion. Of this, the share of rural and urban population is 833 million and 377 million respectively. The decadal change in total population graph shows that it is going down. It shows a declining trend. The share of urban and rural population is shown in this slide. In 2011, as per the Census of India data, about 31% of the population lived in urban areas and 69% is living in rural areas. It is estimated that by the year 2050, about more than 50% of the country's population will live in urban areas. Finally, in terms of some economic indicators, you can see that the GDP growth has shown a slight improvement. Fiscal deficit is going down slowly. Industrial growth is picking up. Food grains production has shown a slight decline since the last financial year. Inflation has gone down, is going down, and foreign trade has shown mixed results. The imports are showing an improvement and increasing trend, and the exports have slightly declined. This brings me to the second part of my presentation, which is on the areas of inequality. I've tried to understand inequality in terms, keeping in mind the human life cycle. You know, when a child grows, then when the child is born, there are certain things that are important for the child, such as nutrition, health, and environment. When the child grows, then things such as education, training, and diet are important for that age group. When the child becomes an adult, then for all of us, there are certain things which are very, very necessary, such as employment, income, housing, infrastructure, services, and assets. And towards, in the old age, things such as pension, welfare, and safety are of great concern to us. So using these broad themes, and a review or analysis of some indicators, I learned that there are serious inequalities that exist in the country. To give you an example, if you look at the infant mortality rate in the country, it stands at 42 deaths of children in the age 0 to 1 years per 1,000 live births. And according to some estimates, about 300,000 children die the day they are born, and 1.2 million die before their first birthday. Some ongoing initiatives of the Government of India include home-based newborn care, universal immunization program, online reporting network, and child death review. Insofar as maternal health is concerned, this is also an important indicator of health. About 178 women die during childbirth per 100,000 live births. It is said that every 10 minutes a young woman dies during childbirth. The ongoing initiatives of the current government are Safe Motherhood Program, Mother and Child Tracking System, Maternal Death Review, pro-poor support, which is in the form of finance to those families who belong to the lower income class. If you look at the sex ratio of India on the whole, it is about 9.43 females per 1,000 males. But when you look at the child sex ratio, the graph which is above, it is showing a decline. It stands at 919 girls per 1,000 boys. The main problem in India is that there is a preference for the male child. Female children are neglected. There is a problem of sex determination at birth and also of female feticide, which has brought down the child sex ratio over the years. And the government has identified 100 gender critical districts, which strategy is being prepared to address the issues. Insofar as literacy rate is concerned, about 73% of the country's population is literate, and the rural-urban gap is going down. For the male population, the literacy rate stands at 80.9%, which is higher than the national average, and the female literacy rate is lower than the national average, stands at about 65%. The gross enrollment ratio figures are shown on this slide. The basic point that emerges from this one is that there is high enrollment in the early years, elementary schooling, but as the child moves to the next stage, when children move to the higher education levels, then there is a problem of dropout from school education because of financial reasons, because of the economic condition of the household and so on. And therefore, many parents are interested in sending their children for work rather than education. High enrollment ratio is observed during the elementary stage also because of the Government of India's Right to Free and Compulsory Education Act, which was passed some years ago, which entitles every child to acquire free education. And then there is this program of midday meal scheme under which this is basically done to attract children to school. So during lunchtime, children are provided free meal. And the third ongoing initiative is scholarships for differently abled persons and for girls. Then there is a program to start a national e-library. And then there is this open and distance learning program. There is the Indira Gandhi National Open University in Delhi, located in Delhi, which imparts education to all those where educational institutions are either not located or where the parents are not in a position to send their child to school. The unemployment rate has also gone down. It stands at 4.9%. This is the number of people actively looking for a job as percentage of labor force. And this is due to a series of measures taken by the Government of India. The poverty rate in India, poverty line definition, which was followed till some time back, was that the daily per capita expenditure should be 27 rupees in rural areas and 33 rupees in urban areas. It comes to nearly $50, but this is a highly contested definition. Many people do not agree because they say that poverty levels in India are underestimated. But as per this definition, now the current government is working on a new definition, but insofar as the previous definition is concerned, according to that, as much as 270 million people were found living below the poverty line. This is 22% of the country's total population. The share of rural and urban population which is living below poverty line stands at 26% and 14% respectively. And the household income has shown an improvement over the years for the poorest as well as for the richest, but the gap, according to the calculations, is more than 5 times high between what the poor person is earning and what the rich person is earning. In terms of access to services, 27% of the country's population is covered by piped water supply within premises, and 83% is covered with electricity. There has been great penetration of the mobile phone. It can be seen in the hands of the rickshaw pullers and the laborers. So So it has shown an increase from 7% to 82%. And there are one survey was done by the OECD, and they tried to find out the growing numbers of people who cannot afford food. And as per this, the percentages insofar as the BRICS nation, which is shown on the extreme right-hand side of this slide, is fairly high as against many other countries in the world. These are some of the employment schemes. I said that the unemployment rate has gone down over the years. It is also due to the Mahatma Gandhi National Rural Employment Guarantee Scheme, which was launched some years back, under which employment of 100 days has been provided to the rural population, so it has brought down the unemployment rate. Some recent measures are the Make in India campaign, under which the Prime Minister is interested in attracting private companies from outside the country to come and invest and do things in India, make things in India, which would automatically lead to greater employment. And then there is a Skill India mission which aims to impart training to the workers so that the quality of expertise that they have increases by manifold. This is the last thing on inequality that I wanted to mention about the shortage of housing in India. It is estimated that there is a shortage of about 18 million houses in the country, and majority of this is for the economic shortage is observed in the category of EWS, economically weaker sections. It's about 56.8%. Because there is a shortage, therefore there is the emergence of slums. It is learned from the Census of India data for 2011 that India's slum population is 65 million, and the decadal growth during 2001 and 11 has increased to 25%. Of the total country's population, one can say that 5% lives in slums, and slum population to India's total population stands at 17%. Slums are found in large cities where there is an acute shortage of land and housing. Finally, this brings me to the third and final, there are 2 slides only, last part of my presentation, in which I wish to say that one can learn from some good practices that have been observed in various parts of the world and also in the BRICS countries. Through a survey of literature, I understood that there is a community gardens project which was implemented a few years ago in Sao Paulo in Brazil, as per which the poor communities were mobilized to run vegetable gardens to cater to their own requirements. In the case of Russia, I learned in Belgorod that an initiative was taken to train people to start and improve their business so that they are able to earn incomes. And this was targeted for the internally displaced persons as well as the migrants. In the case of India, in Ahmedabad is a city in the state of Gujarat, the poor women were supported to start a bank which was called Self-Employed Women's Association Bank, and they were not dependent on obtaining credit from other sources because they refused. So this is like a boon for them. In the case of China, in a remote area called Zulin, there has been economic diversification in an underdeveloped area. Previously the people were practicing agriculture, but slowly it was realized that more incomes and people need to earn more, so they expanded, and now they are producing cement and they are producing several other things because of which the income levels increased. And then finally, in the case of Durban, I learned about the CATO Manor Development Project, under which poor communities are assisted in starting small business. Towards the end, I wish to say that the discussion on inequality is very important in the context of not only India but in many other countries of the world. My research stresses me to make the point that there is a need to address challenges of finance, implementation and monitoring of programs, law enforcement and regulation of activities. These are major challenges if you talk about India. And then the second problem that I feel is that there is a need to ensure better performance of existing institutions. Many things are in the hands of the institutions and if they are not accountable or transparent in their operations, therefore the problems that exist will not go away. And I would say that there is a need to adopt innovative governance approaches. I just refer to the examples of cities in different BRICS countries to make the point that there is a need to document and learn from the various innovative approaches so that the inequalities and the challenge of inequality is dealt with. Thank you very much.
Thank you, Rumi. We now call upon a colleague from China, Mr. Guangping Zhang, who is in the research office of the International Department of the Communist Party of China, and his specialty is political science and analysis, and he is going to give us an overview of the inequality situation in China.
Good afternoon, gentlemen and ladies and gentlemen, and distinguished guests on the inequality across the world. And as a Chinese case, I think is a focus of the world eyes. And although I'm not a professional on social science or economics, but I try my best to make reason behind. I think it's a long story where we spend maybe 3 days not enough to find out the solutions to the comprehensive puzzles or complex. So we better just scanning the main content of this part, and we can focus our thought on China's manifestation of inequality and the response from Chinese government and partners. Okay, how to go back? Now we are focusing on part 2. The topic of part 2 is a reflection of inequality in China and various causes. I'd like to analyze this topic from external point of view and the internal ones. From the external point of view, generally speaking, as a Chinese participating the world economic system and operation, the global industrial division has been speeding up the differentiation and the polarization of the sectors, regions and standards, and highlighting the domestic inequality tendency. The first one, I think, is the double-edged effect of opening up policy and comprehensive participation into the international industrial division further intensify China's industrial structure upheaval, which improved a powerful driver to enlarge the income gap among different sectors. And the second one, I think, is imbalanced asymmetry characteristics of global trade and investment added to the seriousness of the increasing gap among different areas and sectors. On this issue, I'd like to take some cases for my illustration. As we know, the transnational cooperation always operates on the basis of maximum profits. So when they entered into Chinese market, they always prefer to choose the coastal or developed areas as their top destination, because the inland areas in China has less well-educated groups, working forces, and less developed infrastructure, as well as with less consumption potentials. So that's why transnational cooperation will choose the former instead of the later as investing destinations. And I think although Chinese government provides some provincial policies for this multi-transnational cooperation to transfer their financing into the inland area, but I think the free market competition logic replaced the administrative instruction and made the governmental intervention out of order. So in a world, as a result of the imbalanced distribution of foreign capital flows and investment across China, the inland and the coastal area have been enlarged and would likely continue in the future. And the third one, I think, is about the imbalanced tenant flows and payment differentiation exacerbated the structural income inequality among different sectors. I could take another case for this argument. As we know, as we know, that the payment for the workers who is working for the joint venture corporation or the mixed venture corporation sponsored by Taiwanese, Hong Kong, and Macau's peoples also offer a higher average payment for the employees than that offered by the state-owned and collective enterprises. Even within the single foreign-funded company, the payment of the foreign native manager and technicians are referring to the home country's standard, which is far higher than the Chinese employees and workers. So that has very important factors which give a driver to inequality. In addition, I think in the differentiation of hierarchy of foreign-funded and joint venture corporation set a bad example to the Chinese state-owned and connected industry, which in some degree treats the Chinese indigenous or traditional enterprises equalitarianism of income distribution. The fourth one, I think China has enjoyed the dividends brought about by opening up and reform while facing more risk aroused by the economic globalization. That's my argument from the external prospect. And from the internal prospect, I think some existing policies are unreasonable and need to be amended so as to slow down the speed of stunted polarization and increasing wealth gap. I'd like to illustrate this point, my opinion from nearly four aspects. The first one is the unbalanced allocation of the public resource and biased income distribution exaggerates inequality in urban and rural areas, which is has been mentioned by Brazil and Russia and Indian opponents. The urban area got more resource and more provincial policies than the rural area, and the high-quality medical and educational resources are concentrated on big cities, just like Beijing, Shanghai, and Guangzhou. And some people are even not guaranteed the primary and basic education in the rural area. Even in some large or medium-sized city, for example, Jinan, Chengdu, as well as Yantai, such city is medium-sized. There is also existing imbalanced distribution of education resources, which create the so-called intergenerational transmission of inequality. I think that deserves attention on Chinese government. And the second one, I think China's long-term executive household registration system, in some degree, hindered normal social mobility and result in prevailing identity distinction and even status discrimination. The household registration has its own reason in the Chinese history about the rule of law or the enforcement of the labor laws. I think the national legislation, decentralization of local legislation, and the segmentation of social security system will lead to a limited coverage of social security guarantee. Effective arbitration and judgment cannot be ensured when conflicts broke out over social security within enterprises and between the labor and capital. The fourth one is the problem of unemployment has been exacerbating inequality phenomenon. I have quite a lot of data. There will be around 20 million newly increased working population every year in China. I think this number is equal to the sum population of a medium-sized European country, just like maybe 1/4 of the population of Germany and nearly half of the population of France. And so, to create enough jobs to meet the demands of such a huge working group is regarded as the most arduous task in the world for the Chinese government. In addition, China is now in a transformation, in the process of economic restructuring and transformations. It's also difficult for the government to digest the problems aroused by the reform of state-owned enterprises and the central and local administration bear more and more pressure of absorbing a huge group of university graduates. Well, confronted with such kind of so many serious challenges, what should Chinese Communist Party and the government should do? I think there are quite a lot thinking about the resolving of the inequality from Chinese Communist Party and the government. Mr. Deng Xiaoping, the late leader and architect of the opening up and reform policy, was quoted as saying that China is being in the primary stage of socialism, which will be lasting nearly 100 years. The CPC and Chinese government also recognize that there is always market and competition, where the commodity production kept going on. But as we know, the Communist Party of China and the government always insist on the principle of justice during the opening up and reform process, and do their best to prevent the opening up and reform process from returning back to the brutal capitalism. As we know, China has made a very great achievement in promoting economic development and addressing inequality problems. Over the past 30 years, China has already helped more than 600 million population to get rid of poverty, which exceeds the overall number of the population who overcome poverty in the rest of countries across the world. And in the years of 2000, China's GDP reached over $1 trillion for the first time. And this hard-won record was soon broken by China itself, with a total GDP of $2 trillion in 2005, which was followed by $5 trillion in 2009 and $10 trillion of 2014. And just 5 years ago, China has jumped to the second largest economy of the world. Compared to other countries, it took only 14 years for China to increase the GDP from $1 trillion to $10 trillion, while America, the most developed countries, took 31 years. And other developed countries such as Britain, Germany, Japan haven't yet broken through the threshold of $10 trillion equivalent. Nevertheless, the per capita GDP of China is still very low, with only $7,000, whose world ranking is at around the number 80 or even more behind. So in order to accelerate the poverty fighting progress, Chinese government took serious measures to say, okay. Okay, I'm quickly scanning this one. Okay, the first one is ideology innovation, successfully resolved the world-class puzzle of the integration of socialist public ownership with market economy. The realization form of the public ownership could be diversified. That's the recommendation, universal recognition within the party and within the government. And the stakeholder system is one of the choices. By doing so, the Chinese government successfully integrates the public ownership with market economy mechanism and eventually resolve the difficulties of linking the Chinese economy system with the global one. The second one is taking dual tactics simultaneously, successfully realize the dynamic combination of the visible hand of governmental micro control and the invisible hand of the market automatic adjustment. The third one, I think, is deepen the reform on state-owned enterprises, making them to exert a leading role in national economy development, contribute quite a lot to national finance and tax revenue, provide more public goods to all nations. And the fourth one is to keep balance between abiding by the international game rule and safeguarding national economy sovereignty unwaveringly. The fifth one is to accelerate resolving inequality politically and economically and socially. From politically, the party and government are making great efforts to intensify representatives of all groups at a different social layer through constantly perfecting the National People's Representative Congress system and the CPC-led multi-party cooperation system. Economically, the Chinese government and the party pay more attention to the gap between the countryside and city. I would like to take another, my own parents' case. My parents were the laid-off workers nearly 15 years ago, and they are being the age pension per month for them has been continuously lifted from 700 RMB in 2009, which is equivalent to nearly $100 to 3,000 RMB in 2015, which is equivalent to $500, which likes to be increased year by year. Socially, I think the Chinese government needs to create more jobs through establishing more joint venture enterprises. And finally, the last but not the least measure taken by the Chinese government is transforming the traditional idea of only result equality with justice into a new concept of realizing opportunity equality through education. Sorry, I occupied more time, but I would like to end my representation by last word. Finally, I think the existence of substantial differentiation and the relative gap among different groups would be good in some degree to shape a benign social competitive mechanism. And the result of equalitarianism and the lazy society could hence be avoided. But in general, the magnitude of social inequality and the stratification should be controlled within limits. Otherwise, the social stability and development couldn't be guaranteed. That is deserved the utmost attention by all countries and all ruling political parties. Thank you. Thank you.
Thank you very much. We'll go very quickly now into the South African presentation by Professor Shisana. She is not here, so on her behalf, Meredith Evans will present her slides, and we'll thereafter go into a quick roundup of the issues by Rasigan and have a few questions.
I think this is the wrong presentation. No.
This is the only one we have right now.
Okay.
Put it down.
No, the other one is going to update it. Okay, this is it. Yeah. Okay, great. So this presentation is universal health coverage and health indicators for BRICS countries. And myself, I'm not a BRICS citizen, as you may guess. I'm from Canada, but I'll do my best to represent South Africa today. So the objective of this presentation is to propose a strategy for introducing universal health cover in BRICS countries as a vehicle for achieving equity in access to health services and for improving the health of the population. And secondly, to identify indicators that BRICS countries can use to assess the health of their populations. So government contributions to healthcare spending in BRICS countries is currently inadequate. And there is inequitable access to healthcare in BRICS countries, yet access to healthcare should be a right. The BRICS ministers of health have committed themselves to work nationally, regionally, and globally to ensure that universal health coverage is achieved. The goal of universal health coverage among BRICS countries is to ensure that all people have health cover in a publicly financed health system that ensures financial protection and equitable access to needed and appropriate health services that are affordable. BRICS countries have high rates of communicable and non-communicable diseases that can be better managed in a universal health system that ensures coverage for all. Health promotion and disease prevention for all can be better achieved under a universal health coverage system. Because of the diversity of these countries, each one should develop its own universal health coverage strategy depending on its sources of revenue, size and age distribution, and health status of the population, guided by the 9 principles of universal health coverage. And these are the right to health care, universality, equity, comprehensiveness and necessity of services, efficiency and effectiveness, affordability and accessibility, continuity and portability, social solidarity, and public financing. So now we'll turn to healthcare financing in BRICS countries. Okay, so great, we've got the updated data. So you can see that healthcare financing across BRICS countries and the total health expenditure as a percentage of GDP varies across the BRICS countries from the lowest in India at 4% in 2013 to the highest in Brazil at nearly 10% at 9.7%. And so there's lots of differences across the BRICS countries, and comparatively to higher income countries such as Canada or the Nordic countries that have strong universal health coverage systems, their spending as a percentage of GDP would be more around 10%. We look at BRICS general government health expenditure as a percentage of total health expenditure. You see that this also varies, with again the lowest being in India at around 32%, being publicly financed, and then running up to 55% in China. And so conversely, if you look at the out-of-pocket expenditure as a percentage of total health expenditure, that being the highest in India and the lowest in South Africa at 13%. So ideally, with universal health coverage, we would want to increase the government health expenditure as a percentage of total health expenditure and reduce the out-of-pocket health expenditure, and ideally have healthcare free at the point of care. So again, the burden of disease across the BRICS countries is similar in many ways, but also differs. And you can see the maternal mortality ratio has declined in the BRICS countries since 1990, although there was an increase in South Africa due to the HIV epidemic, but it's now brought down to 140. And so currently, well, in 2013, you can see the highest ratios being in India and South Africa, and much lower in Brazil, China, and Russia. And again, the infant mortality rates per 1,000 live births have also declined in all BRICS countries, ranging from 9 per 1,000 live births in Russia in 2013 to the highest being 41 per 1,000 live births in India. And life expectancy at birth by sex for the BRICS countries also varies quite substantially, from lower being in South Africa, from around 57 to 60 years of age, again lower due to the HIV epidemic, and also, so then it goes higher to highest being in China and Brazil. So communicable diseases vary also across the BRICS countries, and with high burdens of HIV, especially in South Africa, at 12% of the population, and much lower across the other BRICS countries. However, due to the high populations, you can see that in countries such as India, the prevalence of HIV is quite low. However, you have still a large number of people living with HIV, over 2 million. And other BRICS countries such as Russia have had an increase in their HIV prevalence in recent years due to government policies, especially against high-risk groups such as injection drug users and men who have sex with men, and criminalization of those populations. So if you look at the TB with HIV burden in BRICS countries, you can see that the burdens also vary with a high burden in South Africa and India, and lower burdens in China and Brazil and Russia. Non-communicable diseases have been increasing, the burden has been increasing dramatically among BRICS countries in recent years. And non-communicable diseases include primarily cardiovascular diseases, hypertension, diabetes, cancers, and chronic respiratory diseases. And these account for 63% of all global deaths and 80% of deaths in lower and middle income countries. And these are considered priority health problems requiring collective effort of the BRICS countries and would be better managed with universal health coverage. So if we look at the non-communicable disease deaths before age 70, the burden of disease, burden of deaths, that can be attributed to NCDs are quite high for all the BRICS countries, over 50% for most countries except for China, where the burden is a little bit lower. And indicators for modifiable risk factors for BRICS countries that relate to NCDs. So if we look at the projected estimates of adult per capita consumption in liters of pure alcohol, you can see that they range dramatically, being very low in India and China, and much higher in South Africa, Brazil, and Russia. And typically, alcohol consumption is much higher in higher income countries. So Russia is quite dramatic. So the title's cut off there, but this is tobacco use. So again, you can see the burden of tobacco use being higher in Russia again, but especially among males, and also in China, and you can see it's lower in India, South Africa, and Brazil. And now looking at physical inactivity and insufficient physical activity of adults. This also ranges for males and females, and differs quite dramatically for the BRICS countries, much higher proportions in South Africa and Brazil, and lowest in India. So strategies for reducing non-communicable diseases. The BRICS countries have committed themselves to introducing policies and programs that aim to address these modifiable risk factors. And this includes reducing tobacco use, unhealthy diets, physical inactivity, obesity, and harmful alcohol use. And under universal health coverage, programs can be developed using new and innovative technologies such as telehealth and telemedicine. To conclude, BRICS countries can reduce their morbidity and mortality by introducing universal health coverage appropriate for each country's different situation. And the strategies for universal health coverage may differ from country to country, but should aim to reduce out-of-pocket expenditure for healthcare and target diseases that are prevalent in each BRICS country. Reducing morbidity and mortality in BRICS countries will contribute substantially to better global health, given that BRICS is home to 42% of the world's population. And common health indicators should be adopted, data collected, and independent researchers should track progress in improving the health of their population. Health promotion should be a part of the universal health coverage in all countries, and universal health coverage is a strategy to end inequities in access to health care. And just thank you to the consortium partners that made this forum possible. Thank you.
Thank you. That was good for somebody who Thank you very much, Meredith. I'm not going to waste too much time. We don't have a lot of time, so I'm going to ask Rasigan to come and do a quick response on all of this, and then we'll have a few questions. We will give you about 7 minutes, Rasigan.
Good afternoon, everyone. Thanks very much for the opportunity to participate, to listen to what's been presented, and then offer some responses. So I'm going to go across this also.